Since its inception, the National Forum has been about collective and collaborative action to improve cardiovascular health for people throughout society. 19 years ago, experts and leaders from the public, private, and nonprofit sectors came together to develop the National Public Health Action Plan to prevent heart disease and stroke. Today, more than 100 organizations, companies, institutions, and agencies make up the National Forum. As we have just heard, they are acting to raise the priority on health equity and cardiometabolic disease prevention. We have heard facts and insights today, some alarming, some promising, that make clear that the post-pandemic U.S. needs a new approach to health. Steve Sidney told us how the way the U.S. has prioritized populations for COVID-19 vaccination has unintentionally added to disparities in health burdens. Betsy Bradley laid bare the disparity in our nation's funding of medical care versus public health, about $10,000 per person for rescue or medical care, compared to just $275 per person going upstream to public health. Fern Melnick and Cheryl Woods-Giscombe highlighted how ignoring and under-resourcing mental health is causing more cardiometabolic disease, and that evidence-based interventions to improve medical and cardiovascular health are available today. Margaret Sabin, Mike Kropp, Jay Bott, and Betsy Bradley made clear that the U.S. needs a new paradigm for health, lest we allow disparities to persist and worsen, and healthcare costs to push more families into bankruptcy and make it harder for U.S. business to compete against countries that spend less on healthcare and get better outcomes. Celinda Lake, Rosie McGillen, and Warren Jones gave us advice we can use to build and broaden support for a new paradigm that prioritizes health equity and prevention, including optimal cardiovascular health. And then, most importantly, we just heard National Forum members share what they are doing and will do to advance our shared agenda. Action is where it is. We talk about these issues a lot, so it's great to hear where action is being taken. And I found these reports from members energizing. I hope that you did too. The Value and Access collaboration holds lessons for us about the power of working together. It brings together National Forum members of various sizes from different sectors to work together on issues that affect people's access to evidence-based care that is appropriate for them. By themselves, some of these organizations would not be active on these issues. But as part of the Value and Access collaboration, they are active and their voices are heard and amplified. Policymakers have noticed the broad support for policies recommended by the collaboration, contributing to 17 states enacting them. Now, as we strive to control COVID-19, we must join together as a force for a new paradigm, a new post-pandemic approach to health. Joining forces will amplify our calls for investment upstream in socioeconomic determinants of health. Joining forces will strengthen our work to broaden support for health equity. Joining forces will accelerate our progress toward people throughout society living heart-healthy, stroke-free lives. The National Forum is one place where we join forces. Please join me now in welcoming back Dr. Warren A. Jones to open the annual business meeting and present the National Forum Awards. Dr. Jones?